So Amy has worked for the Center for Consumer Information and Insurance Oversight since 2010. I'm going to invite my colleagues to go ahead and come on out here so they can see your faces. Since March of 2019, she has served as Dean's Deputy Director of the Division of Small Business and Agent Broker Innovation in the Marketplace Plan Management Group. Prior to working for our group, she worked in the Division of Policy and Analysis in the Payment Policy and Financial Management Group, where she worked on cost-sharing reduction policy and operations with QHP issuers. From 2010 to 2016, she worked for the Division of Marketplace Eligibility Policy and Operations in the Marketplace Eligibility and Enrollment Group, to issue the verification eligibility processes, consumer notices, account transfer with state Medicaid and CHIP agencies, and IRS reporting and Form 1095A generation. So at this point, let's introduce Amy Spiriton.
Thank you, Matt. Thank you, Madeline. Good morning and welcome. Thank you all for attending our first ever Agent Broker Summit. It's great to see all of you and meet each of you in person today. As Madeline mentioned, my name is Amy Spiriton, and this morning I'm just going to give an overview about our Agent Broker program, as well as I'll cover some of the results that we received on our most recent 2019 federally facilitated Marketplace Agent Broker Feedback Questionnaire. I'll talk a little bit about enhanced direct enrollment, and as well I'll give a little overview on our upcoming open enrollment period and what you can do to get ready for plan year 2020. And I'll also talk about the technical assistance support we provide to you all. And let me introduce our team here. So they're here to help answer questions. We'll answer some questions at the end. We have Madeline Pellish, Blake Carlton, Jason Jackson, and Elise Acre. So they all work in our Division of Small Business and Agent Broker Innovation. And I should note that after my presentation, we'll open it up for questions. I think we are asking just to help with the flow of questions that you can either write your question down on a piece of paper and pass it to the end, or if you're with us virtually today, you can type it into the chat. I should also note that we do plan to make these slides available on RegTap after today. As Randy mentioned and Administrator Verma, we truly value and appreciate all of the contributions you all make to Marketplace enrollees throughout the year, and we're here to support you throughout the year. We're thrilled to have about 225, that is an outdated number, about 225 people with us in person today, and just over 2,400 attending virtually. So again, I just want to welcome and thank each of you for attending today. We have just over, this also is updated now, we have just over 50,000 agents and brokers who have registered to participate for plan year 2019. And as Randy mentioned, the number of returning agents and brokers since this time last year, it has stayed roughly the same. It has decreased slightly. And we also have seen an increase in the number of newly registered agents and brokers since this time last year. We're excited to see that agents and brokers have assisted with over 3.6 million Marketplace medical QHP enrollments. And as Randy and Administrator Verma mentioned, this is about 43% of all enrollments. So this really this goes to show how important you guys are to helping consumers, understand their coverage options and apply for and enroll in their Marketplace coverage. So first, I'll talk a little bit about our outreach and communications plan. So as many of you may know, our outreach and communications, it includes, we send emails out to you all, and we use a variety of social media platforms to keep you all updated about upcoming events, new policies and guidance, and new resources. We use Twitter at healthcare.gov and LinkedIn to share information with you online. We also send out a newsletter via email, and we post that to our agent and broker resources webpage, and that happens about monthly, but more frequently twice a month during open enrollment. We also present and host a variety of webinars on various topics, and we host office hours as an opportunity for you all to ask questions in real time with our CMS subject matter experts. And office hours are about monthly right now, and then more frequently during open enrollment. Lastly, we also have a series of learning on demand videos. Those are self-paced learning videos that are available on our CMS YouTube channel to help you, master the marketplace and maximize enrollments. And just this past Friday, we released our first installment of our Agent Broker Video Learning Center, which includes a series of short instructional videos. And so again, those are things that you can access on our CMS YouTube channel. Next, I'll talk a little bit about our annual marketplace registration. As you all know, agents and brokers are required to register annually, and that includes ID proofing, training, you're taking your training and signing your agreements through our Marketplace Learning Management System, or MLMS. We also maintain a publicly accessible FFM agent and broker registration completion list, or RCL as we call it, which issuers can use to confirm that you have successfully completed training and registration for that applicable plan year. We also, as part of the registration process, we review and validate your national producer number, or NPN, to confirm it's associated with an active licensure status for a health-related line of authority in that state where you plan to assist consumers. And we do this by checking the National Insurance Producer Registry, or NIPR database. Agents and brokers who do not complete our annual registration or who violate any marketplace requirements could have their marketplace agreements terminated or suspended. This means that you'd no longer be registered with the FFM and would no longer be permitted to assist consumers apply for and enroll in marketplace coverage. And this could also affect your ability, in most cases, to be compensated by a QHP issuer when assisting with a marketplace enrollment. I'll talk a little bit more as well now about the training component. So CMS offers our annual marketplace agent broker training at no cost through MLMS. And this helps you prepare to help your clients with their applications and enrollment in marketplace coverage. So if you wish to participate in the marketplace for a given year, you do have to complete this training. It is a requirement in CMS regulation. And this training, it entails a variety of components and courses and exams. It includes an overview on the ACA and marketplace basics. It goes over individual marketplace eligibility enrollment, as well as some privacy standards and information security. If you've successfully completed your training and registration for a given plan year, you'll be eligible to take the shorter What's New training for the next plan year. So for those of you who are registered for 2019, you'll be eligible to take that shorter What's New training for our upcoming plan year 2020. And then we also should note that the training is also available through HHS-approved vendors, and this would allow you an alternative to our MLMS training. It also may allow you the opportunity to receive continuing education unit credits in case that's something you could apply towards your state licensure requirements for continuing education. So it is, a vendor may charge you a fee for taking their training. And for this year, for 2019, we have one approved vendor, that's America's Health Insurance Plans, AHIP, who provides that training for 2019. So next, I know Randy talked a little bit about some of our tools. I'll just give a brief overview on some of our exciting tools and functionality. So the first is Find Local Help. And as he mentioned, this is a tool that's designed to help consumers find a marketplace registered, state licensed agent or broker in their area who can assist them with their marketplace application and enrollment. So to use this tool, the consumer would search by their city and state or their zip code, and they'd be able to find a listing of local organizations and agents and brokers in their area who could assist them. Find Local Help includes a location mapping feature and details regarding, hours of operation and other things of that nature to help the consumer make a decision on, where to get help. And as Randy mentioned, this tool also recently we added a print feature so a consumer can print off your information. And with this tool, lastly, I'd just note that consumers are able to filter search results by features such as assistance type, non-English languages spoken, hours of operation, and years of service with the marketplace so that they can make a decision on where to go for assistance. Next, I'll touch on Help on Demand, and Randy also touched on this tool a little bit as well. So this is a real-time consumer assistance referral system that would connect consumers, again, with a marketplace registered, state licensed agent or broker in their area who can provide them with immediate assistance with their application and enrollment. Consumers can use this tool by either requesting to have an agent or broker contact them directly, either by going through the link on healthcare.gov, or they may find the link in an email that the marketplace sent them, and they'll use that link to get to Help on Demand. And then after the consumer enters his or her contact information, Help on Demand works on the back end to match that consumer with an agent or broker who's available and speaks their language and can assist them in near real time. And is also, that agent broker would be licensed in the state, so. Lastly, I'll just mention our Circle of Champions program. This is an annual recognition program for marketplace registered agents and brokers who actively assist at least 20 consumers with enrollments during the marketplace open enrollment period. And so to qualify, we would have to see that your NPN is associated with at least 20 enrollments during open enrollment, and that could be a new enrollment or an active re-enrollment during that open enrollment period. As Randy mentioned, there are different qualifying levels depending on how many consumers you assist, and we do identify new qualifiers ongoing throughout the open enrollment period, and then we'll send you an email with a recognition package if you qualify. So next, I'll talk a little bit more about our most recent 2019 FFM Agent Broker Feedback Questionnaire. So this, I think Randy touched on this as well, and I'll talk a little bit more in detail about it. In 2017, we conducted our first survey and to gather feedback from you all and identify areas where we can continue to improve. And over the last 2 years, we've received over 15,000 responses from you all, and we do read them all. And we've implemented about 100 distinct recommendations in that time frame to help improve our program operations and hopefully increase your satisfaction. So some of these improvements include, we've shortened the time that it takes for returning agents and brokers to complete our annual training. We're continuing to increase scenario-based content and providing additional support for complex consumer scenarios. We've improved the search functionality on our agent broker resource webpage. We're introducing technical enhancements to improve experience using help on demand. We've expanded our Circle of Champions program with a new distinction for folks who've helped enroll over 500 consumers. And we've also launched our agent broker registration tracker as a tool for you all to identify and confirm your registration status with the marketplace. And last but not least, I'll mention that we've developed more self-paced webinars and self-service training resources, including our frequently asked questions database, which these tools are available 24/7 through our website. Overall, we've heard from agents and brokers that you're generally satisfied with our outreach training and registration efforts, but you've raised concerns about, complex enrollments cases and our support, as well as you've indicated you're not generally familiar with some of our direct enrollment and enhanced direct enrollment pathways. And so based on your most recent feedback on our latest questionnaire, we've identified about 40 new recommendations that we're continuing to explore so we can better serve you all and continue, to improve our program as we move towards 2020. So some of these are kind of reflective of what we've talked about, earlier and in our other sessions, but we're exploring how we can improve the ease of navigation with our MLMS and the annual training requirement. We're continuing to increase new scenario-based content and real-life examples that you all have identified and encountered in working with consumers. We continue to coordinate and work collaboratively with our healthcare.gov application team and others internally to address consistent pain points with applications and enrollments, and as well as, getting better to help you all, and support you in working through complex consumer enrollment scenarios. Lastly, I'd mention we're continuing to tailor our outreach and education materials to more specific agent and broker audiences based on your familiarity and tenure with the marketplace, so that hopefully, we're continuing to provide you with information that's useful to you and not redundant or what you already know. So we're continuing to work on those things. And so I would just again say thank you to all of you who have completed our survey. We appreciate you taking the time to do so. We review every response we receive, and we just encourage, this is a great way for you to provide us feedback, and and encourage you all to complete future surveys, and we're always looking for ways to improve the program. Next, I'll talk just a little bit more about enhanced direct enrollment, and I know Randy went over some of this. We're very excited, for plan year 2019 to have launched our new enhanced direct enrollment, or EDE pathway, and this offers enhanced functionality if you're working with an approved partner, and it allows the platforms to be fully integrated so that you can more efficiently enroll a consumer using a private partner's website. You don't have to get redirected to healthcare.gov, and it also allows you to more easily assist clients with year-round policy and relationship management issues, and such as functionality including being able to upload documentation, being able to view marketplace notices such as the 1095A. And so our goal is really to continue to work with partners and gain more partners through EDE so that you have more choices and more avenues in which you can assist consumers. And then by this upcoming open enrollment period, we expect that EDE that will launch additional messaging capabilities that will make it easier for our private partners to offer tools to help you all assist consumers and manage that client relationship year-round. Next, I'll talk just a few minutes about our upcoming enrollment period and things you can do to get prepared for open enrollment. So as you all probably know, this upcoming open enrollment will run from November 1st through December 15th. The Marketplace will send out its annual Marketplace open enrollment notice prior to November 1st, letting enrollees know about that upcoming open enrollment period. And then to the extent that consumers make a plan selection and pay their first month premium for January during that open enrollment period, or to the extent they make their plan selection during open enrollment, they'll have coverage effective January 1st, assuming that they pay their first month premium. How can you all get ready for open enrollment? There are a series of steps you can take, which I'll go over here. First, you'll want to be on the lookout for our Plan Year 2020 Go Live training and registration emails and outreach. And as a returning agent or broker, as I mentioned, you'll be eligible to take the shorter What's New training. And then, you must complete registration by October 31st to avoid having your system access revoked and to ensure you can get compensated for any enrollments you help with for 2020. And I would encourage you, to please complete training and registration for 2020 in advance of October 31st, if possible. That'll just allow, in the off chance you encounter any event issues, that'll allow us to work with you to get those resolved before November 1st. Also, you'll want to make sure you're licensed in the state where you plan, or the states where you plan to assist consumers, and you'll want to set up or confirm the appointments with applicable QHP issuers in those states. We also suggest that you double check your NPN in your MLMS profile to make sure it's correct. And it's also a good idea just to double check the NIPR database just to confirm your NPN and the states where you're licensed and that you have that health-related line of authority for those states where you plan to help consumers. These are just all good things to double check prior to open enrollment starting. And then I would also note that it can take 1 or 2 business days for your information to be updated in our registration completion list after you've completed the training and registration. So you may just want to keep that in mind as you're going through these steps before open enrollment. And you can also use our Marketplace registration tracker to troubleshoot any RCL issues you have. And you can always email our agent broker email help desk listed at the bottom, if you have any questions or concerns. Additionally, it's a good idea for you just to double check all of your MLMS information, your NPN, your email address, your business address, all of those things prior to open enrollment. And MLMS is also the place where you're going to indicate whether you want to participate in Find Local Help and Help on Demand. And so it is, you'll want to make sure your information is accurate and up to date in MLMS for purposes of those tools. And with regard to Find Local Help, you can also go directly to our website and search for your information just to confirm that everything is showing up accurately. And if it's not, you'll want to go back into MLMS to update your information. And with regard to Help on Demand, if you plan to participate in Help on Demand, you'll want to set up or update your Help on Demand profile to make sure your communication and notification preferences are up to date. But if you have participated in Help on Demand in the past and taken that training, you won't have to take it again. We encourage you also just to take a look at our private partner enrollment and client management directory to find QHP issuers and web brokers who you may want to work with who are approved to use the classic direct enrollment or enhanced direct enrollment pathways. These may present you with additional options that you can use to help clients apply for and enroll in Marketplace coverage. And then next, very importantly, you'll want to make sure that you've obtained your client's consent prior to conducting any online person searches for that client or helping them update their marketplace application. There's not a standard format for obtaining consent. You could use a broker of record form, and we do encourage you to obtain consent in writing. However, it is also permissible to receive consent verbally from your clients. Now, as many of you may know, it's a good idea to have your clients authorize you to access their information and work with the call center on their behalf. Your clients can either call the call center and provide them with your information, or you could conduct a three-way phone call with your clients and the call center just to make sure that authorization is in place prior to open enrollment beginning. And just a few other tips here. We recommend that you check out our Agents and Brokers Resources webpage, our frequently asked questions, our Learning on Demand videos, as well as just checking out our website and call center and help desk information so you can learn how you can assist consumers, and also just so you're familiar with these resources and where they're located. You'll want to also be on the lookout for invitations to our open enrollment preparation weekly webinar series in October, as well as you can register for office hours, which are weekly during open enrollment, to again raise questions with our subject matter experts in real time. And just a few final tips here. You may want to host and participate in community events and work with assisters and navigators in your area. We would note, though, that assisters are forbidden from endorsing or referring clients to specific agents and brokers, but this may be one type of community engagement that you may find helpful. We also have a series of toolkits and templates online for marketplace materials, and these are things that you may want to print out and put a stamp or sticker with your information on to have available and share with new or returning clients of yours. Lastly, if you qualified for Circle of Champions in 2019, you could use those recognition package materials you received to promote your achievement and promote your achievement with your current and potential future clients using marketing or social media, whatever channels you use. So lastly, I'll just go over the technical assistance we offer to agents and brokers, and then I'll open it up for questions. So scenario one, and I know this is something a few of you have raised, your NPN, you're not seeing it on an application you assisted with, or you may have concerns that your NPN might have been removed. So firstly, I think as Dean mentioned, if you do have concerns that your NPN was removed from an application, that is not intended, and it's definitely something we'll investigate and look into. So But let me just say, if the client's application does need to be updated with your name and NPN, you'd want your client to go back into healthcare.gov, go back into the application help portion of their eligibility application, and just make sure that your name and NPN are on the application, or update that information if needed. And then I would note we have a tip sheet on this scenario that we are in the process of updating. It is very important that if your client is making an update to their application, even just to add your NPN and name, that they have to resubmit the application and reselect the plan and plan compare. That initiates an 834 to the issuer with your information. So we're in the process of updating a tip sheet on this scenario just to make it very clear what steps the consumer would have to take in this situation. We would also suggest you contact that issuer just to discuss the situation with them and see what might be going on. And as always, you can always email our agent broker, email help desk, if you're not able to resolve the situation through these two previous steps mentioned. And we would just ask, that you include the marketplace application ID, and we'll do a thorough investigation to see what might have happened. And Yeah, so, you could definitely reach out to us. And if you do email us, you can also let us know if you have a concern that maybe the NPN was removed from the application, and we'll do a thorough investigation. So the second scenario is just one where you're trying to update a client's application and you're getting stuck or receiving an error message. So in this situation, if you're using a classic direct enrollment or an enhanced direct enrollment partner, you'd first want to reach out to that partner just to see if there's a known issue that they know about and could help you with. Otherwise, you could also contact our Marketplace call center. But if you're not able to resolve the issue through either of those channels, again, you can email our agent broker email help desk to request assistance, and we'll investigate the matter. Now, we would ask, just that if you can provide a detailed explanation of the issue or error you're encountering, and the website or the URL that you're using. This will just help us pinpoint exactly what's going on. And then also, you'll want to include the Marketplace application ID. Always a good idea to include that Marketplace application ID if you're having any consumer-specific issues or eligibility and enrollment, questions or issues. And I should lastly just note that our agent broker email help desk is not able to handle requests to expedite documentation reviews or appeal reviews, especially if it's not a medical emergency. And then we just, thank you for your patience during open enrollment. Sometimes volume can be a little bit higher, but we do try to work through and investigate your issue as quickly as possible. So lastly, I just have 2 slides here that go over some of our key help desk and call centers. You've heard me mention our agent broker email help desk. We can help respond with any enrollment and compensation questions, any general questions or issues you're having with MLMS, training, registration, and some of those tools I mentioned earlier, find local help, help on demand. And then, of course, you can always reach out, and you should reach out if you have any concerns about, fraudulent or abusive conduct, from a consumer or another agent involving another agent or broker. Our Marketplace service desk, their email and phone numbers listed here, they can primarily help with any CMS enterprise portal account issues, error messages, password issues you're having with the CMS enterprise portal. And then next we have our Marketplace call center, which I think most of you are familiar with. They can help with consumer application, consumer-specific eligibility and enrollment scenarios, application issues, or any issues the consumer may be having with their healthcare.gov account. Lastly and finally, the Marketplace Appeals Center, that phone number is listed here. They can provide the status of a Marketplace eligibility appeal, as well as specific instructions on how to appoint an authorized representative with regard to requesting a Marketplace eligibility appeal on the behalf of a consumer. Here are just some of the acronyms we've used in this presentation, and you're probably all familiar with, but I think at this point we can definitely open it up for questions, and I just want to thank you all again for coming, and I think we are asking for people to write down their questions if you're here with us in person.
Actually, we will take a few live
okay.
questions. We just have time for a couple of live questions, so it's going to be the first couple of people that make it to the mic. There are 2 online questions I want to go over as people are queuing up. One was a request to extend the length of time for open enrollment, and is there consideration on extending that? What I can tell you is that the length of time for open enrollment, the day it starts and the day it ends, that's a regulation, so in order for that to change, we would have to propose that, and it would have to go through the rulemaking process. So I'm not aware of any regulation floating out there that is being proposed. Jason, the next question is for you. There was a comment about MLMS, the Marketplace Learning Management System. There was some suggestions. Is there any way that you can make the user interface a little bit more user-friendly? I don't know exactly what that means, but do you want to just talk a little bit about that?
In terms of the MLMS, yeah, I mean, we're constantly looking at at MLMS and ways to improve it. There were definitely some comments from the survey about returning brokers couldn't find the shorter training. So we actually did look at the code, and it is set so that at the very top of lists, when you log in and you have your list of training courses, the very first one on that list is the returning. So if you don't see that, contact the help desk. We can always look and see what's going on. Now, if you didn't participate in the marketplace last year, like you took a year off, then unfortunately you can't come back and reuse that returning one. You're gonna have to go through the whole long, multiple courses again. But yeah, I mean, we've definitely cleaned stuff up. We've in MLS we've added some verbiage to the fields to kind of clarify what you should put in terms of individual versus business information, so that hopefully all your contact information, we can access it better if we ever need to reach you.
Should I ask my question? In your circle of champions, do you guys consider those of us brokers who write a lot of group business on the exchange? I noticed that there's a lot of individual awards, but when I count my groups, I do a lot of groups, and it's in the hundreds, and I don't get a Circle of Champion award.
And Blake Carlton's going to take this question.
Hello. Are you referring to shop business
Yeah,
groups?
shop business.
Okay, no. Shop business groups do not count towards Circle of Champions. They are now run through the insurance company. That's how a consumer would enroll for a shop plan. So we no longer have data on enrollments for shop.
Okay, thank you.
Bruce Pesco, New Jersey. I don't know if this is the proper time or place. If it's not, please direct me as to when I can ask this question. The most frequent time that we go on to make changes for people are to change their income from the projected income that we did during open enrollment. And when you change the income, there's a question specifically, are you changing income? And the answer is yes. It then puts you through the entire application again. It terminates the old coverage, starts a new plan. Don't understand all of that. And then number two, part to that is if there was a birthday, it then increases the premium because people are a year older now than when we filled out the application. Is there a reason why you can't just go in and change the income?
Yes, I know we have heard a little bit, from folks about that being a pain point when you, are updating. You have one field on the application update. That's how the system currently is designed. Unfortunately, yes, you have to kind of step back through the whole application and resubmit it. We've definitely shared your feedback with our, eligibility and enrollment team. So I think it is something we're considering, but, I guess also, the eligibility is complicated, and it does have to take into all those factors from the application. So, I think, that's something we can continue to explore and think about.
And I can also just add, then we'll move on to the next person, that, we're continually making updates to the healthcare.gov application as well, just like we're making enhancements to direct enrollment. So we're taking that back. That's not the first time we've heard that, and we'll take that back and send it along to our enrollment team. Thank you. Renelle.
Thank you. Ronell Nolan, Health Agents for America. First, I want to thank y'all for all your hard work because we have made huge strides. But talking about auto enrollment, has there been any dialogue with the insurance companies to use that as an event to remove agents and brokers off all applications and not pay any compensation?
I think, you want to go ahead, Madeline? Sorry. No, you can take this. Yeah, sorry. Yeah.
We work collaboratively
Yes.
here. There is no systematic way that an issuer should be removing an NPN, but we do know that issuers have different policies sometimes around payment of commissions for a bar renewal as opposed to an active re-enrollment, an active enrollment. And so we encourage agents and brokers to work annually with your clients, with your consumers, to make sure that that plan actually fits their needs for the coming year. But I think that's where you may be seeing the difference.
Right, and I totally agree that we should be touching everyone, but what the insurance companies are saying is if it comes from CMS, then we're going to remove you. It must come from you for us to include you, which is just a way to remove agents and brokers. It's really unfair.
So the batch auto renewal policies do not strip NPNs.
Oh, no, you don't.
And the issuers should not be doing that either. When they receive it on the 834, it should still retain your NPN. But again, as a best practice, you want to make sure that you're going and seeing that it's still on there. And if you're having a systemic issue with a specific issuer and can give us some examples of application IDs where they're not paying you commission, but you see that your NPN is on it and they pay you commissions for other policies, I would strongly recommend that you send us an email to the Agent and Broker Help Desk. And if that's a situation that we need to follow up with the issuer, we're building those bridges to really work on your behalf and collaborate with the issuers to make sure that their systems are in place to reflect those enrollments.
Thank you.
Hello, my name is Patty Jo Toller from 5 Star Insurance Group. And my question basically is, why can't there be an ad agent link that doesn't require us to re-enter that complete enrollment form? Somehow,
Are you asking about making an update to an application? Or,
no, just adding the agent, like if there wasn't an agent on there,
To the-
or there was an agent that wasn't assisting the client and he wanted us to update that agent information?
for
Is
the
there-
consumer's
Instead of going through
application?
the whole complete enrollment form, which may cause other options or issues?
Right, so that's similar to the other question that we received around the application. Really, during our prior session around compensation, first of all, you should not be adding your NPN to an application where you're not already working with that consumer and received the consumer's consent ahead of time. And then as you're walking through the application, you'll go to that application help screen at the beginning of the enrollment, where you can enter in the NPN and your name and show that the consumer, if they're using the healthcare.gov pathway, that consumer should be indicating on their account that they received assistance from an agent or broker. If you've gone through the enrollment or the person has enrolled on their own in a prior year, and then you're working with them for a mid-year change or an SEP, you should be able to, as Amy explained, both walk through the application help section to add your NPN and your name, but also make sure that you're selecting the plan again at the end of that process. Once that plan selection is also done, that information will be sent to the issuer on the 834 to reflect that you were assisting them with that enrollment change or application, the life event change. Do we have any questions online? We're keeping you from lunch.
Yeah, so,
Madeline, can I do one?
oh,
This is what I've seen. I've done this for 5 years now and enrolled lots of people. I've got my clients complain that they're getting phone calls from the marketplace, 3 to 6 calls a day from marketplace people, and that it's almost bordering on harassment, and that may be why our NPNs are getting removed, and that frequently I've already enrolled these people, and they're telling me they're still getting called. So that's an issue, but a bigger issue is that I've had clients get enrolled by me into ACA plans with cost-sharing reductions and APTCs, and they're getting called again by other brokers to put them into non-ACA compliant plans, pay higher commissions. They don't understand how those people are getting their names and phone numbers and contacting them. And sometimes it happens within a few minutes of their finalizing of their registration on the marketplace. That to me is a huge concern about privacy.
You just hit the nail on the head, Fran. Thank you. Really, in terms of privacy and security and consent, this is the example that you're giving of kind of a robocall, kind of a system. We're aware that there are lists out in the systems. That's not necessarily related to marketplace calling. And what we're doing is really stepping up that consumer consent information on the front end so that we're looking at which agent and broker actually is valid and helping that consumer to do the enrollment. If you have specific cases where your client is being contacted or having their information changed, we really are here to support the work that you're doing and encourage you to give us those application numbers so we can conduct investigations and really dig deeper to understand what's going on and prevent any fraudulent activity. I think we're aware that there are lists out there, and we want to make sure that you and your relationship with your consumers, that you're working closely with them, that you are their trusted partner for marketplace coverage, and that we're able to protect that to the extent we can. Dean, do you want to add anything?
Nope, it's a really great question. Thanks for asking that, Fran. And I just want to point out that, of course, the marketplace, healthcare.gov, never shares information with anybody. So just want to kind of make that obvious point. At this point, we do need to wrap things up. Cheryl is going to, she has a few logistical things, and then we're going to let you go for lunch. Thank you, Amy, and thank you, entire team. This is part of my wonderful team that makes it all happen. Give them a round of applause.